I'm pretty sure we all know what this is. Today, I'm not going to persuade you to become a consumer. I'm not going to say that weed is the best thing ever. And I'm not going to tell you that weed will guarantee you happiness and perfect health because it won't. Instead, I'm going to try to persuade you to become pro-pot in order to get this medication available to those that need it. This will not only help in terms of our health, but also better our society as a whole. As a legal marijuana user patient for 2 years, I have had first-hand experience with this substance and the community it represents. First, I will go over how marijuana got its bad reputation. Then I will talk some effects and treatments. And finally, I will discuss how it all works in our systems. Now, let's discuss how weed got its bad reputation. Back in Nixon's presidency, he marked the famous words, "War on Drugs." Soon after, the DEA deemed weed as a Schedule 1 drug, which, as the DEA states on their official websites, are defined as drugs with no current or accepted medical use and have a high potential for abuse. Schedule 1 drugs are the most dangerous drugs of all drugs, with potentially severe psychological and physical dependency. Soon after, people began to associate weed with other Schedule 1 drugs such as LSD, heroin, and ecstasy. From then on, people have been afraid of this, so much so that there's even propaganda supporting the outlaw of marijuana. This just contributes to what we used to believe in and how we used to fear it. Now that I've gone over the background, let's discuss what weed can do in terms of health. As we all know, in the state of California, weed can be used as medicine. In a clinical review conducted by Matthew J. Seaman labeled "The Medical Marijuana and the Development of Pharmaceutical Roles," he discussed what weed is qualified to do. State law permitting medical marijuana typically defines the appropriate indication as serious, chronic, or debilitating medical conditions, such as nausea, vomiting, associated with cancer chemotherapy, HIV infection, cancer, neurological disease such as pain syndrome, and glaucoma. They also state that weed can be used to treat movement disorders. This can include Parkinson's disease, Huntington's disease, and Tourette's. While on this topic, weed also releases symptoms of asthma, reduces anxiety, and improves sleep. Now that we've gone over the background and treatment, how does it all work? Well, weed is composed of several chemicals, but the ones we mainly focus on are cannabinoids. There are hundreds of different cannabinoids in the system, or in marijuana, but the most common ones are called THC and CBC. HCC is responsible for that psychoactive effect, the reason why people feel high from smoking. CBD, on the other hand, has non-psychoactive traits, and has more medical uses. It can reduce nausea, suppress seizures activity, act as an anti-inflammatory and an anti-tumoral, and much more. The chemicals excreted from the plant are then ingested, inhaled, or eaten, or whatever. The chemicals then bond to these things called receptors. These receptors influence our nervous system and immune system. The reason why these chemicals bond so easily with our human receptors is that they are structurally similar to chemicals already found in our brain. For example, THC, as you can see here on the top left, looks kind of similar to dopamine, which is the chemical responsible for happiness. And as you can see that, so in retrospect, that globular, ugly shaped looking protein thing bonds with that chemical and it forms a reaction which is sent through our nervous system. In conclusion, today we've gone over some history, treatments, and science behind marijuana. With this, I hope to have educated you on something that used to be extremely feared, and I hope that most of you will will see the value in marijuana on health. And I would just like to say this one thing: if you don't need it, don't use it, because there are lots of patients out there that really need it, and a lot of people that don't really need it. Thank you.